All right, I'm sitting here. We're doing a little kind of morning talk session with our star fellows. Dr. Colon is at home sleeping, kind of, relaxing while these two guys are getting ready to work their tails off. Just kidding. Um, Guys, how's the first couple weeks of fellowship been?
It's been good. It's been a great kind of really hitting the hard points of aesthetic surgery. So it's been great.
That's awesome. I mean, I guess the only negative Cortez is dealing with his issues.
Uh, I've, I've had a great experience with Dr. Cortez's.
We love all of our attendings equally.
Yeah.
So, this week has been we're coming to the tail end. What's a highlight of this week so far?
Harley and I did a really big body contouring case with Dr. Kleban, who's a patient that lost quite a bit of weight. While we in residency did each part of the surgery, I've done each type of those surgeries. We did them all in one surgery in a really fast and like efficient manner. So it's good to see. It was a bra line back lift. It was a lower body lift, circumferential abdominoplasty with muscle plication, as well as a mastopexy. We finished it in like 5 hours. It's pretty quick.
So this is an important thing, for our viewers and patients considering these things. It's really nice when we can do all those things together, but the thing we never want to compromise is safety. And so, luckily, with our infrastructure, with the talent that we have of Dr. Kleban, who's just a rock star, and then also, our amazing fellows, and you guys have all, been in training for like, you know, decades, and have incredible skill. But we can together, handle these cases that normally would take, some providers would take. It would take. I don't know how long you think that case would take, just in a solo surgeon type thing outside of
Eight,
here.
9 hours.
8 9 hours.
I don't think we would have even attempted it.
No, and the reason why is you don't want a patient to get cold.
Right.
You don't want them to get blood clots. You don't want them to have issues. But at the same time, patients don't want to have multiple surgeries. It's a huge kind of invasion of their normal daily life. But that's really awesome. Dr. Kleban's really great at kind of getting those amazing results. And a lot of these things started when Dr. Hunstead kind of would be, was a big proponent of this idea of circumferential contouring. So many patients come and see us and they want to have their anterior part of their torso. And we're pretty good about kind of talking to them, hey, don't forget about this posterior part because you're a three-dimensional structure. And what you guys ended up doing was you did a total lower body lift
Yep.
and you did an upper body lift simultaneously, which is remarkable. And so hopefully that lady's all done. Well, that's pretty excellent. I'm doing a upper lid blepharoplasty on a male soon, and a laser resurfacing, and then an abdominoplasty with hip roll liposuction. So much more smaller compartmentalized procedures. Harley, why don't you tell some of our teammates why would we do? This guy's going to do his upper lids and the laser resurfacing under anesthesia. Is that always required?
Not always required, no. You can do a lot of things under local with some oral sedation medications, Pronox even. Definitely can do it without.
Pronox is nitrous. And the thing is I tell you, part of it is like, and you guys will see, is that just because you can do something a certain way doesn't mean that you do it that way. You have to kind of adjust it based on patients and the patient experience. And I think that like at HKB, we're, you can be so hyper focused on the patient outcome, but so much of it is that experience too. And so, it's important to kind of figure that out because the one thing we don't want is someone to be like, oh, I like my result, but my God, the process of doing the surgery and, I felt pain or heard noises and stuff. So it's important to kind of think about that when you're picking what you're going to do. All right, well, we're going to get after it and take care of some patients and have some fun. Hasta la vista.